cool. Let's go ahead and call to order our Washoe County District Board of Health, Thursday, February 23rd, 2023. That's kind of a play on numbers. That's kind of fun. It's good to be back, everybody. Hello, Christopher Dare. It's good to be here with everybody. It's an honor. This is my first official board, first board I've been back to since surgery, so honored to be here. Let's go ahead and have roll call and determination of quorum.
Chair Dare.
Here.
Vice Chair Dare will be absent. Mayor Luz Garcia.
Here.
Michael D. Brown.
Here.
Dr. Denko.
Here.
John Clacking, PhD, will be absent. John Novak.
Here.
Chair, we have a quorum, and I'm your recording secretary.
Wonderful. Thank you so much. And Mr. John Novak, would you lead us in the pledge?
Please join me in the pledge. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, let's go ahead and move on to welcome to Commissioner Mary Luz Garcia. So welcome. I know last week was supposed to be your first, but we'll celebrate today. And so I don't know if you want to share anything. You recently were elected and doing great things I already hear, so welcome. Do you have anything you'd like to share as we start? Very good. Very good. We appreciate your participation. There's a lot of different things that the health board does, and I know our staff is ready and willing as much as you are to kind of show you all the fun things. So thank you. Let's go ahead and jump into approval of the agenda. Any questions or motion?
Make a motion to approve.
We have a first.
Second.
And with that, all in favor?
Aye.
Any opposed? Passes unanimously. Please vote on the screen. And let's go ahead and move on to introduction of REMS's health mascot. Now, I have one request that he's going to come up here and take a picture with us as well. Okay, very good. I'm going to let him come to me this time, though. But Riley the raccoon, will everyone give him a hand? Come on.
Are we on? Okay. Good afternoon, Mr. Chairman, members of the board, Alexia Jobson, Director of Public Relations for the record, and Riley, the REMS Health Raccoon for the record. A couple of months ago, I mentioned that we welcomed a special new team member to REMS Health, and today I am pleased to introduce you to Riley, the REMS Health Raccoon. Riley is made possible through partnership funds between REMS Health and the Washoe County Health District. Riley helps share important public health and safety messages about topics that will improve the health and well-being of all Washoe County citizens, but particularly our youngest citizens. Riley helps share information about things like CPR, mental health, vaccinations, pedestrian safety, first aid, and how to help patients find the right level of care. Riley is looking forward to warmer weather and the special event season in Washoe County so they can meet more people and share more safety information. The best place to keep up with Riley and what they are doing is to follow us on Instagram. You can find us and Riley at REMS Health.
Welcome.
Any questions for Riley?
I think if you ever need a fill-in, that's about my size. I think I can.
Perfect. We'll stick around for some pictures, but thank you so much for inviting Riley to join us. Do you want to do that now? That would be excellent.
Let's come take a picture now while we got, yeah.
Perfect.
No, we're coming. No, come.
Or you come this way, please. Oh, yeah.
Yes, good idea.
For this one. It'll be a little easier on this guy. That's okay. Change it up a little bit. Come on in. Wait, I am taller than you. I like that. I like you even more now. Come on, look closer. Thank you.
Thank you. Riley doesn't blink.
Thank you so much. Nice to meet you. We have some recognitions to go on. Mr. Dick.
Yes, thank you, Chairman Dare. I'd like to begin with years of service, and this month we are recognizing Anna Heenan for 25 years of service. She's not with us today. She began her career with the county in February of 1998, so congratulations to Ms. Heenan. And we also...
Let's give her a hand. She's not here, but 1998. I graduated in 1990, so yeah,
Yeah,
the 90s, good years.
And Janine Rosa, 10 years of service with the Health District, began in air quality in February of 2013. Is Janine here? No? She's hard at work. All right. And then we have a couple of new hires, and I'd like to begin with a request for Daniel Timmons. If he could please introduce Jordan Volk to us, new air quality specialist.
Good afternoon, members of the board. Daniel Timmons, Senior Air Quality Specialist. Jordan Volk started with us about 3.5 weeks ago. He comes with us with extensive knowledge he's spent time with Nevada County Environmental Health Services. He had 1 year with the Washoe County Tribes and 1 year with the Nevada Division of Environmental Protection. And he's a graduate of UNR in environmental science. We're very happy to have him. He's already hit the ground running hard, asking great questions and making our monitoring network better. So please welcome Jordan.
Welcome. Welcome. Do you want to say anything? Go ahead.
Just happy to be here and looking forward to helping out as much as I can.
It's always good to have our locals stick around, so thank you for sticking around.
Yep, born and raised.
Thank you.
Thank you.
All right. And next, I'd like to ask Lisa Lotritz if she could introduce Jennifer Vivar-Guerrero, new office assistant 2 with CCHS.
Good afternoon, Lisa Lotritz, Division Director for CCHS. I'd like to introduce Jennifer Vivar-Guerra. And first, I'd like to commend Jennifer. She is the first one in her family out of 4 siblings to graduate high school and attend TMCC. She received her dental certificate at TMCC. She didn't stay in dental long. However, she pursued a career in the medical field to help her community. She has gained many skills with her past positions, excellent customer service, being a strong contributor to a team's success, and having a positive attitude in the workplace. Jennifer is excited to work at the Health District because its whole purpose is to serve the public, and she loves that there are so many services in one big place that can help the community. So I'd like to welcome Jennifer.
Welcome, Jennifer. Do you want to share anything? You want to say anything? You can sing a song. Thank you for sticking around here and serving our community.
Thank you.
All right.
Good job.
Congratulations. We have a promotion to announce. Jackie Lawson being promoted from an office support specialist to an admin secretary in epidemiology and public health preparedness. And I believe that Ms. Lawson is out of the office this week. Yeah, I see heads nodding.
Yeah, good job. If she's watching, I know she is. She's
Yes,
out
well,
there.
Well deserved. And mentioned Anna Heenan with 25 years of service, so it's not uncommon when that happens that we have a retirement. So I'm announcing that Anna is also retiring effective March 1st, so best wishes to her on her retirement.
Wonderful.
We also have a transfer to announce. Kelsey Zaski, who is coming to us from HR, and she'll be an office support specialist in epidemiology and public health preparedness. And we're very glad to have Ms. Zaski coming back. She was part of our COVID-19 response and does excellent work. So really pleased to see this happening. And I have large number of Washoe County health heroes to recognize today, and I'm really pleased to have all of these people to recognize. We've been working to promote for our staff to recognize one another through the Washoe Health Heroes and not to use the Washoe Stars when they have an opportunity for that recognition with our board. And so I'd like to begin with Sheila McCoy, who's being recognized for compassion. And is Sheila here? Yeah, if you could just, thank you, stand up. And then stick around, we'll do pictures here at the end. And Jan Hauk, also being recognized for adaptability, trustworthiness, and collaboration. And I'd remind the board also that these recognitions are for the health district's values. And so this is the first recognitions as well of the new values that the board adopted under the strategic plan. So congratulations, Jan. Also, Connie Taranov for adaptability, trustworthiness, and collaboration. So congratulations. Patrick Silveroli for adaptability, trustworthiness, and collaboration. I'm not sure Patrick's here today. Okay. And then Lauren Huntsman for collaboration. Congratulations, Lauren. Cynthia Arredondo, trustworthiness, collaboration, inclusivity, and compassion. So congratulations. Anna Gonzalez for trustworthiness, collaboration, inclusivity, and compassion. So congratulations, Anna. Liliana Ponce for trustworthiness, collaboration, inclusivity, and compassion. Chris Ballou for trustworthiness, collaboration, inclusivity, and compassion. So she's not able to be here today. Alejandra Rosales, also for those same values. And we have Alejandra here. Kayla Solario, also for those same values. Mary Cruz Schaefer, also for the same values. Not sure we have Mary Cruz here today. Samantha Beebe, also being recognized for those same values. Let's see, Sammy. Latricia Lord for compassion. There's Latricia. Olivia Alexander for trustworthiness, adaptability, inclusivity, and compassion. So I'm not sure we have Olivia today. Kristen Palmer for adaptability, trustworthiness, and collaboration. And this is a double recognition. She was recognized twice. And Rachel Cord for excellence in adaptability, collaboration, and compassion. So congratulations to Rachel. And then we have a number of honorable mentions. Also, Kaylee Solario has an honorable mention. Jackie Chaidez, Julio Peck, Andrea Clark, and Deanna Karlichek, all for honorable mentions. So congratulations to all of those employees and for their demonstration of our values.
And we're going to try to get a picture with you, but I do want to say that, you know, we serve in a lot of boards, and we don't do this typically on other boards. But I want to tell you that in the role that we play in the health district, I think it's crucial that we do, when we use the word compassion and we use the word caring and all of the different things that we're just given to you, it's huge that we take a moment. And I know for some of you are like, yay, I got a trophy, whatever. I'm telling you, it's huge. You are the hands, you are the heart that goes out and touches our community. So thank you. And so when we take a picture with you and we take a moment, it's not something that's just extra. It's something very important. So thank you. And I'm going to come down. It will take me a minute, but if you all want to start making your way down, we're going to come down here and take a picture. Are you ready for that? Am I ahead again? Okay.
I saw you.
I know, I was like, I hope he's there.
Yeah. All right. And I think we're good. This is perfect. All right. Here we go. In 3, 2, 1. Cool. Thank you. And then we're going to do with our new hires. Our new hires, come on up. Congratulations, especially you guys. How's everybody doing?
Well, that was fun. It's good to see all those people. Let's go ahead. Now, next we're on to public comment. Do we have any public comment?
We have no registered public comment.
Well, that makes me very happy. That's good to know. Let's go ahead and go on to number 8, COVID-19, our flu RSV update and information. We have staff, Kevin Dick, Mr. Dick, and then also Dr. Rika Denko going to give some update.
Thank you, Chairman. Good news to report, I think, overall. So for COVID-19, we are remaining at fairly low levels. Our 7-day average for new cases is 34. That's over the past week, 260 cases. And I think we were about 277 last week. So it's gone down a little bit. There was a slight increase in wastewater a couple of weeks ago, but the most recent wastewater report showed it dropping back down a little bit again. So we're, I think, seeing that trend reflected in the case numbers that we're getting. So our community levels remain low. No real impacts on the hospitals. As far as the subvariants, we are still trending a little behind what we're seeing nationally. The BQ1.1 subvariant is our predominant lineage, and just over 35% of our cases are that BQ1.1. And then the next highest number or percentage of cases is the XBB 1.5 variant. So, and that's at almost 22% of 110 samples that were genomically sequenced over the last 4 weeks. And while we're seeing those different subvariants, I don't think we're really seeing anything that is indicating that it's becoming more contagious and things are taking off, or that people are having any more severe illness due to the subvariants. And so I think that's good news, and we might just continue to see subvariants shifting around because we know that these mutations happen with COVID-19. And I'll continue to report on what the state lab finds there. As far as the RSV, our cases are down to 14 cases for this past CDC week 7. So that's down from 263 cases that we had at the end of November, beginning of December over the week. And so nice to see the levels getting very low. Our pediatric hospital units are no longer stressed with cases. But this brings our season total of RSV cases to almost 2,000. We're at 1,999. And a typical year, our case number for the season going through all 20 first weeks of the year is about 750. So it has been a pretty significant RSV season, but glad to see the numbers are now really low. And on influenza, our influenza-like illness activity from our Sentinel providers is at 0.9% of the patients that they're seeing, so that's down from 1.2%. We only had one hospitalization over the past week, and so our flu numbers are also now down very low, and flu's transmission in Nevada is considered to be minimal. So positive news, I think, on all those fronts, but I will defer to Dr. Danko.
Great update. I think, I echo what Kevin said, and I really think we stay cautiously optimistic. We are seeing better trends, but that being said, we still see patients with fairly high severity of illness in the hospital. We still do see patients who don't do well with illnesses. So I think that what we've been talking about with prevention metrics and keeping good hand hygiene and making sure that we're still cautious is always a good thing, regardless of the numbers and the trends of the viral illnesses. There are other illnesses out there all the time, like gastrointestinal things, that it's nice to prevent by those good hygiene metrics that we've been talking about all along for a long time. So good numbers, but we remain cautious. So
One question I did have for you is I know that a lot of people, because not wanting to go to the hospital during COVID, all that stuff, there's a lot of things that got pushed off. Our hospital's pretty busy at this point. What kind of advice would you give out there for those who are waiting?
Yeah, I think that's a really good question. I think that we have seen certainly many different trends over time with COVID, and definitely we had people who avoided coming to the hospital because of fear and because of uncertainty of what lives in the hospital, and certainly hospitals can be risky places unless you absolutely have to be there. What I will say is that COVID has also impacted some of those chronic illnesses, because people who have had COVID once or multiple times can certainly have long-term effects long-term cardiac conditions, long-term lung conditions that can be in effect as well. The best advice I have is that we are definitely open. We're open and very much accepting patients. We're seeing ebbs and flows when it comes to hospital census across the weeks, just depending on how things course. But if you have a condition that you haven't had checked out, it would definitely be an optimal time to get it checked out, because generally if something's not right, waiting on it it could be detrimental and could be life-threatening. So it's better to seek medical attention, seek the help, and we can start to get things figured out right away.
Thank you. We'll move on to our consent items. Anybody want to pull one and talk about it, or do we have a motion?
So moved.
First,
Second?
second. Any other discussion? All in favor?
Aye.
Any opposed? Passes unanimously. Let's go ahead and vote on the computer as well. Okay, we are moving on to number 10, Regional Emergency Medical Services Authority, and I'll hand this over to Mr.
Chair, if I may, I need a vote from Dr.
Oh, it didn't
Dinko.
come through?
No, it didn't.
Mine's not on.
Okay.
Well, I'd
So
like to say it
If I could
was-
just get your verbal vote, and I'll take it in there.
Yeah, we did a verbal vote, so did you catch that? All
Unanimous.
all in favor? It was
Yes,
unanimous.
aye.
Yeah, it's frozen on mine.
All right, it's a little technical difficulty, but we'll move on with item 10, which is our acceptance of the Remsa Health Operations Report for January 2023. I'd like to ask Mr. Barry Duplantis to come down.
Good afternoon, Chairman Dare and members of the board. I'm Barry Duplantis, CEO and President of Remsa Health for the record. Before I get into my report, I'd like to take this moment to introduce two promotions that we have completed in Remsa. Both gentlemen are present and here today, and I'd like to introduce them. And as I introduce them, I'd like them to stand so you can see who they are. First off, I'd like to introduce Mr. Adam Hines as our new Chief Operating Officer. Adam?
Good job.
And in addition, I would like to introduce Mr. Devin Walker, who's been promoted to Chief Financial Officer. And both of these gentlemen have been with Remsa now for a few years, Adam for significantly more years, and have just been outstanding contributors to the organization. I understand you've been provided with a copy of Remsa Health's January 2023 report. I'd like to highlight for the month of January for the fiscal year to date, Remsa Health has been fully compliant with Priority 1 calls in Zone A and Zones B, C, and D. One note I'd like to make is that we continue to experience year-over-year growth in the demand for 911 EMS services as our community continues to grow. And many folks use 911 to access healthcare. And the percentage of patients that we go to it has been increasing in terms of transport to hospitals. Just to put that in a little bit of perspective, in January, we responded 8,102 times. That's about 261 times a day. We're responding to a call. We transported of that over 5,000 calls in the month of January, and it works out to be about 161. So to the point of our health system, our hospitals have been seeing our vehicles there quite a lot. So that's just a bit of report as to where we are. And as I said, we have been fully compliant with our franchise agreement. Very pleased to state that here today. And aside from that, I'm happy to answer any questions that any of you may have.
Any questions from our board?
I've got a comment.
Sure.
I've noticed on the very back page back there, where we see Remsa compared to the national, all our numbers are up this time. I want to commend you. That's a lot of work because those numbers are hard to move. But I did notice it, so it's good trend. Keep it up.
Thank you very much. I appreciate it. And I might just comment to that. The one thing that has remained consistent in terms of the responses to the questionnaire is that the majority of the responses seem to come from 45-year-old folks and older. We still struggle with trying to figure out how to get the younger folks to respond to the questionnaire. Why that's the case, I don't know, because the questionnaires go out, without regard to age. But that does seem to be the feedback.
Gotcha. You need to use Instagram. Very good. Thank you. Do we need acceptance?
Yes.
Yeah.
Make a motion to accept the report.
First, do I have a second?
Second.
We have a second. All in favor?
Aye.
Aye. Any opposed? I see none. Let's go ahead and vote on here. Passes unanimously. It's frozen again, by the way.
All right, we have a unanimous passage, so we'll move on to 10B. I'd like to invite Alexia Jobson to provide us an update on REMSA Health's public relations during January.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Director of Public Relations for the record. You have for your review the public relations report from January, and I'd like to share a few more recent updates with you. With February being Heart Month, REMSA Health's Alma Marin and Adam Hines participated in several heart health-related media interviews, including one with Colo News Now, one with KUNR, the local NPR station, and another with KRNV Fox 11 Reno. Also, two REMSA Health employees, Monica Teves and Chris Watson, were recognized as nominees at the annual Heroes with Heart Awards event hosted by the Trauma Intervention Program of Northern Nevada. Terry Russell from Colo 8 News Now spoke with Adam Hines earlier this month about the proposed state legislation that would formalize an interstate compact for certain medical professionals, including paramedics and EMTs, to work in other compact states without having to get that specific state's certification. Also, I wanted to mention to you to please save the date for EMS Week 2023. From May 21st through May 27th, REMSA Health will host its awards and recognition event on Monday, May 22nd from 11:30 a.m. to 1 p.m. And of course, all of you are invited, so please watch your email for more information on that. And finally, I wanted to follow up on the board's previous request to identify ways that individual board members might assist with the Choose the Right Care awareness campaign. Right now, we are planning on working with you in small groups to create video assets that can be used across multiple digital platforms and shared with our news media partners, as well as on your digital channels as well. This seems like the most efficient way to start the project. I will be reaching out to you individually about creative details and scheduling. So I'd like to say in advance, thank you, and I appreciate your willingness to participate in and support this important message. So I'll be in touch. I'm happy to answer any questions you might have.
Will you just make sure you remind us again about the date? Because
Oh, absolutely.
It'd be great if we could all be there. I've been to most of them, and there's really good food, but there's also good people there.
Yes.
One of the things that happens is these guys here get to hear from us that they've done a bang-up job, but their whole staff is there. And it may not seem like it, but when we show up, they actually care.
It does. It definitely, and that's part of why we moved the awards event to the beginning of the week so that we might have more community member and elected participation this year.
Which also means when we're not there, they also care, if you're just wondering. But thank you.
Thank you very much.
All right, we can now move on to item 10C. Update and possible approval of corrections to typographical and grammatical errors, omissions, and duplications in the recently updated REMSA amended and restated franchise agreement. So we have Sabrina Brazel.
Thank you for that. Good afternoon, board. Welcome back, Chair Dare. I'd like to take a moment with this agenda item to just highlight a few of the reasons that I'm here before you. For those that were not present in August of 2022, the revision to the franchise was done through a group effort of the Joint Advisory Committee. As a result of that, a new draft was created that was then approved by the District Board of Health. It was several versions, shopped through several different areas and software use. So when it was presented, what was not noticed until use in December of 2022 for other programmatic activities was that there were several omissions, some duplications, and then also putting a critical eye back on the content. We noticed that the language did not, had specified the inclusion of a map as well, which had not previously been included. So the other omissions and corrections that I'd like to highlight are several bullets that were included in Article 4.1 specific to the market survey and competitive bidding. This has not been applicable during the time that this error has occurred, so there was no impact to the franchise as a result of these omissions. Also, some small grammatical corrections for use of the word tie in comparison to the word time. The map that I mentioned is now listed as an attachment at the end of the REMSA franchise, and it is specific to the 2014 initial version of that response map. And then the other note of importance is 15.1 had a duplication of information that was specific to a separate section, so that has been corrected. And I would like to present for approval the amended and restated with most grammar and corrections made. There is still some opportunity for some language revision at a future date, but I think that this covers the problematic concerning areas that would also be due for review and need, as well as being cognizant that we don't want to nitpick the grammar down to the fine level of correction.
Yeah, I feel like my English teacher always told me I had a lot of opportunity as well. I understand.
Well, thank you for the grace. This was frustrating and challenging to find, but I'm glad that we have the opportunity to bring it back so that it is as correct as possible until we put another lens on it and realize that we have future revisions.
Any questions from the board? Okay, then we are looking for a motion to accept.
So moved.
Have a first, do I have a second?
Second.
First and second, any other discussion? Excuse me, I see none. All in favor?
Aye.
Aye. Any opposed? Passes unanimously, and let's see if the computer seemed to work. If I hit it and then it froze after I said yes. Okay. There.
All right, worked. All right, the next item that we have on the agenda is the reappointment of Dr. Rika Danko as the appointed physician for a second term of 2023 through 26, and for possible action.
Yeah, before we get into this, I want to first say it's interesting, I know. and so, but it's been good, and it's been great to have you here. But I do want to share a couple things that people understand. Sometimes people wonder, how the heck do people get on this board or on any board? So I'm going to brag on her because she doesn't do this herself. Let me just share a little bit about our Rika Danko, our Dr. Danko. She's Chief Medical Officer at St. Mary's. In her role as CMO, Dr. Danko will advise clinical oversight and supervision of hospital staff and operations with a focus on quality and safety, utilization, and physician practice evaluation. She was hired October 2022. Dr. Danko she wasn't hired, was it October 2022, is that right?
Yep.
As a chief medical, okay, I say you worked there longer than that. Dr. Danko is board certified in internal medicine and addiction medicine. She earned her medical degree at the University of Nevada, Reno School of Medicine in 2008, where she also completed her residency in internal medicine in 2011. Dr. Danko is a clinical assistant professor at the University of Nevada, Reno School of Medicine. She is on the UNR Med Community Faculty Advisory Board. Also has had teaching appointments as course director in practice of medicine, a systems-based clinical skills course, where she contributed to curriculum development, standardized patient instruction, and clinical case development with focus on the bio-psychosocial spiritual model. In the past, she was Chief Medical Officer at Northern Nevada Hopes and hospitalist for Carson Tahoe Hospital and Northern Nevada Medical Center. I share this to say that, when we sit back and we ask for people's opinion on things, I want you to know we respect it very much. It does not mean we always agree. That does not mean all of those things. We all have conversation, but then we call that brainstorming, and we all work together to come up with the best answers. At least that is our goal. So I want to say thank you. I don't know if any other board wanted to say anything, but I wanted to thank you personally.
I'd like to thank her for being here. She's added a whole new dimension that we never had before, to somebody being active and everything else. And I would like to nominate her for another term.
I'd like to second that one.
Please, nobody oppose. What's this? All in favor? Aye. You're not allowed to oppose. Like if she opposed, she's all nay. But do you want to say anything?
Thank you. I will like to say that I am just humbled and honored to have this experience. I'm not sure I knew exactly what this was going to entail when I started in 2019, I believe in January, but it has offered just so much development, and I've met so many amazing people here at the Washoe County Health District, as well as all of the community partners, at a time when it was potentially the most interesting to be a part of a health board during a pandemic. And I'd like to say that I'm so honored and so thankful and so grateful every day for what I get to do as a physician and seeing patients, but also what I get to do to work together with the interdisciplinary team, with everybody here. Every single person has an opportunity to help others, and that's really what medicine's all about, is helping each other, and as we highlighted earlier, compassion. The pandemic brought a lot of compassion fatigue because it was so exhausting at times, but I think that we have come out the other side with even more compassion and more thankfulness and more gratitude for what it is that we get to do. So thank you again, and thank you for those kind words, and thank you for the opportunity. I'm looking forward to whatever the next 4 years has to offer.
Oh, no, it's an 8-year term.
Oh.
I'm just kidding. It's not.
Thank you.
And you froze again, by the way. There you go. Okay.
All right. The next item on the agenda is discussion and possible direction regarding legislative issues regarding the 82nd Nevada legislative session. And I received a text from Ms. Gutman Dodson that she had to return to the building. There's stuff going on down there, but I'll do my best to provide a little update for the board. So far, I think we're off to a pretty busy start with the legislative session. And on February 13th, I had the opportunity, along with the other health authorities in Nevada, as well as Megan Komlasi, who is the Assistant Director of the Center for Public Health Excellence at UNR, to provide a briefing on public health for the Assembly Health and Human Services Committee. And that was very nice. We were afforded an opportunity for an hour presentation with questions and answers. We were there about almost 2.5 hours. So a lot of interest and engagement on the part of the Assembly committee members. And then I was able to return with the same group on February 16th to the Senate Health and Human Services Committee meeting, which Senator Doniate, the chair of that committee, invited us to join him in introducing SB 118. And that is the bill that provides for a public health improvement fund. And it would appropriate $15 million per year to that fund that would then be distributed by population to the health districts. There was an amendment to that bill to add Carson City, basically a designated health authority, because they're not set up as a district right now. And it would also provide the flexibility with those funds so that they could be spent on community needs that were identified, and the District Board of Health would have the authority to make the decision of how those funds are spent. There's a requirement for an annual report to be provided back to LCB, and Senator Titus graciously friendly amended the bill during the session to give us 90 days after the end of the fiscal year rather than just 45 days to get the report together. And let's see, the other specifics on the bill. It does allow the State Division of Public and Behavioral Health to use up to 5% of the funding off the top for administrative or statewide efforts. And the bill also has a sort of a separate piece to it, which is currently under NRS 439 for establishing a health district. It requires if counties are going to establish a health district together, they have to be adjacent counties. And so this bill would remove that word adjacent. And that would allow for Eureka County to join fully the new Central Nevada Health District that's been formed. So that district is Churchill, Mineral, and Pershing counties, along with the city of Fallon. They are all contiguous with one another. But then Eureka is the next county over past Lander. They currently are working in that health district with a contract for services, but by allowing them to join by removing the word adjacent, then Eureka County could have their members on the District Board of Health to really have it be a real health district across those entities. So that's that bill then was amended, as I mentioned, and passed out of the committee on the same day that it was presented. So it was kind of exciting to see that move quickly. We put out a press release. I was pleased to see we got some publicity around that because it's going to be a little tough to keep the momentum going on that bill. As the lobbyist from Southern Nevada Health District said, we've put it into orbit, and now it's going to orbit for a few months because since there's money attached to the bill, next it goes to Senate Finance, and Senate Finance won't be able to act on that until the very end of the session when they do the money matters, and they've got to get the education budget agreed upon first. So there'll be a frenzy of activity, and I'm sure Ms. Gutman-Dodson will be under a lot of stress while we're trying to move that bill forward out of the Finance Committee and over to the Assembly. A few other updates. The AB 69 was also heard in the Senate Committee on Education. That's the Washoe Regional Behavioral Health Policy Board, BDR, presented as the bill, and it will expand the loan repayment program administered by the Nevada Health Services Corps to expand that to provide student loan reimbursement for more behavioral health providers practicing in Nevada. And it's seeking $1.5 million to provide that loan repayment support. It also would extend that loan repayment to behavioral health faculty at our institutions of higher learning because they also are struggling with having the faculty they need, and this would help incentivize that as well. We're also engaged in discussions around some other bills, a couple on tobacco, one that has to do with enforcement against selling to minors by the retailers. They currently receive 2 warnings before anything concrete is done, and we have very poor compliance rates with our retailers, and so we're seeking to remove the warnings, and we believe the AG's office is also in support of that. And then there's a bill that we're concerned about that would exempt casino areas from requiring proofing people for age for selling tobacco products in the casino area. And our concern is that while, yes, minors aren't supposed to be there, they don't really have a good mechanism to check people's age and keep them out of there to begin with. So we think it's appropriate to check their age before selling tobacco products there. There's a bill that is being discussed regarding food vendors, basically sidewalk street vendors, and we have some concerns with that bill. It would make it easier for them to be able to operate on public sidewalks and reduce the amount of oversight and licensing authority. I don't think it affects us directly, but we work in partnership with our jurisdictions and their business licensing programs in trying to address some of the street vendor issues that we have. We're also working on legislation that's being discussed around sexually transmitted diseases and treatment for minors to make sure that we have the ability to provide those services. And a bill that we're concerned about is in regards to offering customers water in restaurants. And they are proposing that the health authorities be the enforcing agency for people serving water without the customer requesting it. And we're just concerned about what that means for our staffing needs with having to respond to every complaint about somebody getting served a glass of water. So that's kind of my overview. I'm sorry we don't have Ms. Gutman-Dodson here today, but that's what I've got for you. And things are starting to move down there.
No, I think it'd be good to keep a close eye on our water one. That could be interesting. Did you say there's any on our licensing issues when it comes to?
Yeah, I don't have all the specifics on that bill, but its intention is to make it easier for street vendors to.
No, I'm different. I'm sorry. Let me just say licensing. I'm more talking about when it comes to mental health and some of the different things. It's been a concern of mine greatly that we have the rules we have and how we're laid out actually harm our community because of not being able to transfer in and get the doctors and the different needs we have. And so I know I heard that was coming at one point, but I don't know if I heard you talk about that.
Yeah, I don't think we've seen anything on that yet. I know that Senator Stone has said that he wants to move that forward.
Okay.
During the session. The governor has an executive order that the licensing boards are not to do anything additional at this point. So he's also trying to use the power and authority of the governor's office to try to prevent them from making things worse and put pressure on them to make things better. Because we do have barriers in this state.
If we could ask just to have that come back, that's one thing I'd like to keep an eye on. I think that's probably one of the more harmful things that we have in place at this point.
There is going to be also a bill, thanks for bringing it up, there is one that also talks about interstate compact for EMS as well that would help with.
You guys mentioned. Yeah.
With the staffing in those areas.
That's great. Any of those kind of things that would be very important. Thank you. Any other questions or thoughts? Board? Very good. Do you need action on that?
Unless there's any, I don't
think there's any change on
direction.
Yeah.
All right.
Okay.
So I think the next item is mine as well. We'll move on to the recommendation to approve the fiscal year 2023-24 budget. And first of all, I want to thank our Administrative Health Services officer and his staff. The budget, I'm presenting it. This was prepared by Mr. Zentino, and I know with huge contribution from his fiscal compliance officers. So I really appreciate their hard work on this, as well as the division directors and staff that have all contributed to putting together this budget. And so I got some slides that I wanted to run through for you, and everybody should have a hard copy of the slide deck for this. If we could move on to the next. Just as a reminder, our mission is to improve and protect our community's quality of life and increase equitable opportunities for better health. Next slide. You gonna give me a pointer? So, as a reminder, these are the things that we do to protect our health in Reno, Sparks, and Washoe County, preventing the spread of communicable disease, ensuring food, air, and water are safe. Thank you. Preventing chronic disease and injuries, supporting maternal and child health and development, providing needed clinical services, and providing a variety of services that are specific to Washoe County's needs. We've had a number of accomplishments that we've had in the past year. We've prepared the FY 24-26 strategic plan, completed our first health equity organizational capacity assessment and plan, and we're nearing completion of the 2024-2026 community health improvement plan. We've expanded our social media channels and Spanish language communications dramatically, and brought on board community health workers that are now helping ensure clients access to necessary health care and social services. We've begun the work, executed the contract with the Abbey Agency to rebrand to Northern Nevada Public Health. We've implemented pilot programs to educate realtors about septic rules and regulations. Septic issues are becoming more prevalent in some of the real estate transactions and what people are concerned about. So working on outreach and education there, as well as outreach and education around food safety, providing instructional videos and other resources to help control foodborne illness risk factors. We have restructured the family planning sexual health program so that we have walk-in service for clients every day, and in particular promoting walk-in Wednesdays still for the afternoons where school gets out early. And we initiated the Zero Suicide program, and staff in CCHS have completed the mental health first aid training, resulting in 81 of our staff members being certified in mental health first aid. So, just a few of the highlights, and we don't do any of this without our staff, our most valuable resource. And in the budget that we're proposing, it would bring our full-time equivalents at the health district to 198. I think there was a typo in your handout with 199 originally. And the reason it's 198 is that's our health district FTEs. And we have one position in tech services I'll talk to you about, but that we would provide the funding for, but the position would actually be counted as a tech service FTE. So with the proposed new positions, 7 new positions, we would have 179 full-time staff, 6 part-time, and then we have a large number of intermittent hourly positions for nursing and advanced practice nurses, dietitians, and we also use a number of students in a part-time capacity, and sometimes a short time for internships that are public service interns. So this is the way we have organized the health district with all those employees, and I think it's a little tough to see the org chart here, but what I'm going to do is to kind of run through what this looks like in each of the divisions. The actual budget documents that you have for the detail, the spreadsheets, are actually organized under the 22 different program areas that we have that have a separate budget account under the health district. So that's the way our budget is constructed, is under these programs. But as I said, I'm going to run through what the above base requests are looking like for each of the divisions. And to begin with the Office of the District Health Officer, we have 13.1 full-time equivalents, and for FY24, we would have a little over $1 million in revenue coming in, and that's through the CDC Health Equity Grant that we get passed through from the state, and then also transitioning some of those staff to a grant that the state will be awarding us that's a CDC workforce grant. And then we have about $3.44 million in expenditures. The above base requests that we're seeking is one for travel to support the workforce in my office in their professional development and travel opportunities, as well as supporting the board for travel needs, to expand that by $8,500. And then we're proposing also a new position, public information specialist, And communications was an area that when we did our foundational public health services assessment, it identified that we should have more staffing there. And I think that we recognize the importance of communication and education through the past few years, and needing to make sure that we're getting the correct information out, and people aren't just hearing misinformation about what's going on. So that's a little over $100,000 for that position. That would also provide us with some additional internal capabilities. We're currently contracting out for some of the graphics support that we have with our communications that can offset some of those costs. For administrative health services, we are not requesting any above base requests or above base for FY24. I will note that we do have a vacant fiscal compliance officer position that Mr. Zentino is working to recruit that wasn't filled over this past year. And so that is something that still is going to enhance our capabilities there, and I think provide us with some better support, hopefully, for being able to pursue some of the competitive grant opportunities. For air quality management, we have 20.4 FTEs, and air quality management, we have revenues of about $4.4 million. They come in through a variety of sources. We have 2 different federal grants from EPA. We have the fees for permits and services, and then we also have air pollution control funds that come in from the smog check program, where we get $1 for each smog check certificate that's issued for Washoe County. And so the total FY24 expenditures, direct expenditures in that division that we have is $4 million. So a number of these above base requests in air quality are taking some of the operating costs that are currently on the air pollution control funds and moving those to the funding that comes in through the grants, but I think more primarily through the fees that we charge for permits and services through air quality management. And so this one keeps us true to using the money that we're bringing in from that division that's for cost recovery to support the cost of that division, and 2, kind of cleans up that air pollution control fund to be used for special project stuff. So I think it was last month that the board approved the contract with the UNR Business Environmental Program for air quality assistance services for permitting. That's an example of the type of use of the air pollution control funds. And then also adding 2 new air quality specialists to the permitting program to increase their work and make sure that we're issuing permits timely. One of the reasons for this is that EPA has been placing more and more scrutiny on minor source permits, the air pollution sources that don't need a major federal air pollution control permit, and looking to see if these permits are being done properly and we don't have sources permitted as minor sources that really should be major sources. And we've seen some enforcement actions that have happened in other jurisdictions where enforcement's occurred against a company because they didn't have the right kind of permit. So we want to make sure we're spending the time and effort to issue the proper permits and have it be a federal permit if that's what's required, and not have anybody in our community get burned because we didn't do a good job on our end.
And I want to say there's a wisdom in this. I was talking to Mr. Dick earlier a little bit about this, and there's a wisdom in making sure that our revenue is not really just based upon grants that could go away. And so I appreciate that kind of thinking on Francisco. Good job. And I think that gives us, especially because as our community ebbs and flows and we have some questions about what the future holds and how finances roll or don't roll. So I think this is a good move.
All right, thank you. Next, I've got Community and Clinical Health Services. This is our largest division with almost 77 full-time equivalents. Their revenues of a little over $8 million and expenditures of a little over $13 million. And a few things that we're doing with CCHS is we have 3 community health workers who've been doing an outstanding job for us, that we brought on board with short-term funding that we had from that CDC Health Equity Grant that I mentioned. And that is going to be ending. And so we previously discussed with the board that we wanted to really put a stake in the ground on health equity and continue with these positions. And in last year's budget, we actually projected these as part of our ongoing costs. So this is now bringing them on to local funding to sustain them within the budget. And that's just a little over $250,000. And then with the TB program, we had a grant where we had staff on. One of our staff retired. The other person that then took that position under the grant was at a lower pay level than the person that retired, and they increased the percentage that the grant covered. But now that pay level is going up. We have annual merit increases. The grant can't support that, and so we're shifting that back around to put more of that position on our local dollars and also to support some of the supplies for the latent tuberculosis treatment that they do at the clinic. We have also a above base request for a reclassification of our clinical office supervisor at CCHS. We believe that this position wasn't categorized properly with the level of work that they're doing and the staff that they supervise. And so that would increase the pay and benefits by almost $20,000. And we're also looking to reclass our office assistant 2s to office assistant 3s. And that's 12 of those in CCHS. They can provide a higher level of service in a fiscally responsible manner. But I think the other piece that's in play here is that we have a very tough time holding on to OA2s in the health district because there are other opportunities for them to get a position as an OA3 in other departments in the county. And I'm going to talk about the Hay reclassification or pay and classification review that was done county-wide. And we're still waiting to get specifics on the results. It could be that out of that review, I think one of the things that was being considered is this become more of a series where people could move from an OA2 to an OA3 without having it be a whole reclassification process and whatnot based on time in the position, those types of things. So we're watching that. But that's about $100,000 for that reclass request. And then similarly, we're looking to increase the types of work that our community health aides can do to move them to human services support specialists. 2 of those positions, about $8,000. And then the one that's the real important workload investment is another senior public health nurse within CCHS to help lead teams and deal with some of the workload challenges. So about $150,000 for that position. Under environmental health services, this division currently has got just over 45 FTEs. Revenues of a little over $5 million and expenditures of about $8 million. And our above base requests are for staff clothing that's for the rebranding. These are staff that are out in the field, and so some new clothing and safety attire type jackets for EHS staff that would reflect the new name. I don't know that I mentioned, but we also included some of that in the above base budget for air quality management. And then for workload, we're seeking another registered environmental health specialist to be able to keep up with the growth that we have in the community and make sure that they're providing those services. And proposing an administrative assistant 1 reclassification to an administrative assistant 2. To both expand the scope of what that position can do, but again, to try to keep employees retained within the health district versus being picked off by different departments in the county. And then The next slide I've got is, this is the Technology Services Developer 2 position. We really need technology services staff that can be devoted to the work that we need done in the regional permitting platform, ACELA, to support our needs in environmental health and in air quality management, and to improve our customers' experience on the citizen access outward-facing piece of this. And so we've been working to see how we could do this, and the Community Services Department has already started, and we're following their model, where they pay for tech services to have a developer that's committed to fulfilling their needs. And so this would be a position that we would split 80-20 between EHS and air quality for funding the position, but it would actually be considered a tech services employee. So that's why this one doesn't show up on our FTEs here. But the intention is that this employee would live in the health district and provide those services to support those divisions. The Office Assistant 3 is a new position that we're proposing, and this is again for health equity purposes. We don't have very many of our registered environmental health specialists that are bilingual, and they are interacting with a lot of businesses in the community that are owned and managed by Spanish-speaking people. And so the intention here is to have a bilingual Office Assistant 3 that can accompany our inspectors in the field and help with that communication and education work with them. And then we've got $33,000, almost $34,000. It's really a cost redistribution to balance grants. We've got grants that don't quite support the level of people that we need to fulfill those program requirements, and so to fix that issue. In epidemiology and public health preparedness, that program has got 27 FTEs. They have $9.6 million in revenue and $9.2 million in expenditures. This program has seen a huge increase in their funding because of the COVID grants over the past few years. The above base request is $11,000, and that's really driven by the increasing costs of the paper that we need to buy for the birth and death certificates, and it's special for security purposes to avoid identity theft. So that's driving that above base request. And so, how do we come to these recommendations and decisions?
Let's make sure that there's no there's a lot of information that was just given. Does anybody have any questions or thoughts or anything? I just want to make sure. So it's hard to come back that far sometimes. So.
Thank you.
Continue.
Thank you. I've got a clear path now.
Yeah, you're good.
So we came to these decisions based on the work we've been doing, what we've discussed with you at during the strategic plan. We've had our community needs health assessment. We've been working with our organizational capacity planning, both the health equity plan and the work with the National Public Health Foundation and the Foundational Public Health Services and Calculator, and also looking at customer experience and how can we make sure that we're working to support the customers that we have here at the Health District. And I think we worked to try to hear what the Board of Health was saying, what we were hearing from staff and community stakeholders. And I'm really pleased with the process that we had, which resulted in the division directors all really working together to understand each other's needs and coming to agreement on where we should be making these investments in the Health District. So to summarize the above base request, 7 new positions. So 2 air quality specialists for AQM, 1 senior public health nurse for community and clinical health services, 1 registered environmental health specialist for EHS, and 1 office assistant 3, again, for bilingual and accompanying inspectors in the field for EHS, 1 technology developer that would live in, would be part of tech services, but would work here to support environmental health and air quality, and 1 public information specialist to enhance our communications through the Office of the District Health Officer. And then those 3 community health worker positions that are, the grant funding is ending, and we're sustaining them by moving them to local funds, along with the reclassification requests that I mentioned to you for those variety of positions. So there's a table that provides in detail the different items that are part of the above base request. In this table, I think you'll see on the left-hand side, there's a whole bunch of AQM items, and a lot of them are small amounts, but that's that moving things, operational expenses, to where we're getting the revenue from the fees and the permits. And I'm not going to go through this line by line.
Thank you.
And this table is basically how we're expending the funds, and this is the sources and use summary. So this is the format that's required to be submitted to the state, and it basically shows you that we have a revenue budgeted of $176,511, and we have expenses of $39,530,454. So this would be a deficit budget of $1,353,943. Because we have a projected $15,728,695 ending fund balance at the end of this fiscal year, we would use some of those funds to cover that deficit, and we would end up with $14,374,752 in our ending fund balance for FY23. So we're moving from 42.7% of the fund balance of our overall funds or expenditures in the fund balance to 36.4%. So spending the fund balance down a little bit. And I'll talk with you as I go along and we get into the future year projections, but why we don't want to, a couple of reasons why we don't want to take a bigger hit at the fund balance right now. When you look at the pie chart on budgeted revenues, the federal and state grants are almost 51% of the budget. The state grants are less than 2% of our budget. So this is a huge increase that we've seen over the last few years in the federal grant contribution to our budget, which previously I think was closer to 25% of our budget. And this is driven by the COVID-19 grant investment. And in my staff report, I think I outlined that it's about $11 million more in our budget than what the board approved originally last February for the FY23 budget. But that's because of the federal grants that have come in and those grants that have also been accepted by the board during this past year, FY23, that added to the adjusted budget for the health district. And sent with that piece of the pie expanding, it makes everything else a little bit smaller on the piece of the pie, so that brings our general fund support down to less than 25% of the budget. And then the next pie chart is our expenditures, and salaries and wages and employee benefits composing 70% or so of the budget. The other pieces of this pie that are bigger because of the federal funding that we have is the professional services and other agencies, the orange slice, where we have contracts with temp agencies for staffing for a number of the COVID positions, because we know that that funding is going to end, as well as the red piece of the pie, other services and supplies. That's inflated because of the expenditures for services and supplies for our COVID testing and immunization activities.
Quick question.
Sure.
Did we see an increase in PERS? We actually got hit pretty hard as a city.
Yes, we did have an increase in PERS, and it's I may have to put out a lifeline to tell you what the percent change in that was, but I'm sure it's the same one that you experienced probably at the City of Sparks.
Ours is a little different. I know we pay 100. I think we do half as a county.
We fully fund PERS,
Okay.
but with the increase, the way it works now with the policy is, as PERS increases, the increase is deducted from the salary on the front end. It doesn't show up as a salary for the employee that then they pay toward. It's deducted. It's basically the COLA is reduced by the amount of the increase in the PERS contribution that's split between the increase split between the county and the employee.
Yeah, that's what I was saying.
Yeah.
So it's probably not as bad as a hit of what we got hit, but still, so that shows in here.
Did I say that right, Mr. Zentino?
That's just a very real hit. I'm assuming that you have it in here. I just didn't hear it from you.
And here's the rest of the story.
Jag Zentino for the record. I think that you spoke correctly. Yeah, I don't have the percentages available, but you're essentially correct. We follow the same logic as the City of Sparks and the City of Reno, so I can get you the percentages if you're interested.
But I'm just saying that does reflect in here the PERS that are coming, and because that was, I think it hit everybody. I just want to make sure.
Yeah.
It is. Yeah,
Thank you.
The timeline was short, but it is reflected in those numbers.
I assume so. I just didn't hear anybody talk about it, which that's a big hit. So
It was pretty extensive this
Yeah.
year. It was.
thank you.
But that's a good question, and it is incorporated in
Thank you.
these numbers. Then the next spreadsheet is looking at out years. What does this look like if we go forward with this proposed budget? And in FY 24-25, currently the COVID-19 grants that we have are scheduled to end at the end of June of 2024. So those funds and the staffing that we have with those funds are not reflected in FY 24-25. We don't know for sure if that's when they're going to end. There's some discussion that it could be that the end date gets rolled forward, but that's the information that we have now. With removing those funds and those expenses, we end up, although we are projecting a deficit spending of a little over $2 million, we still end up with $13.5 million in the ending fund balance. And since the overall budget is a smaller number, the ending fund balance ends up being a larger percentage of that overall budget. So it jumps to 44.7%. One of the things that we're trying to do with this budget is to look forward to what happens in FY25 when we have the end of those COVID-19 funds, and the wanting to try to preserve some of the staff that we brought on board as Washoe County employees and have the opportunity to move them to local funding at that time. And so that will be one of the things that we expect to bring back to you for FY25 budget. But we don't know exactly how many of those staff that's going to be. We also have some of our staff that we're losing through attrition. They're finding other opportunities now, and that's fine because our needs are also going down as the level of COVID is down in the amount of work that we need to do. So we'll be assessing that and anticipating bringing some of those staff on board. And I think that's also one of the reasons that we had such a small above-base request for epidemiology and public health preparedness this time is, as you'll recall, they got that $9 million budget with the COVID grants. That's probably where we'll be looking for trying to add some additional positions above base next year with that grant funding ending.
So I want to say that I do think that you're being conservative, which I think is wise. I'm going to say that because this does not include the potential of any state finances or continued federal support or county doing anything else or any of those things. This is saying if we have to live in our means by what we have. So we really could be doing that much better if we get any of those step up, which probably somebody will, but it's wiser to not assume.
And let me mention a couple of things that I have talked with our chair about, and that is we do have ARPA funding coming to us to replace the Title X funding that we lost the federal grant on, and which will carry our family planning program through December of 2026. We're working with the state now on that award, and while we don't have it yet, we know what it is, and that ARPA funding has been included in this budget and the projections. And then we are also working with the state on the award for the $10 million in ARPA funding that we have coming to us for the new building. That has not been put into this budget at all. And so when we have that award, then we'll be bringing that to you and taking it to the county commissioners to supplement the budget there. So the other thing that's in play that I want to discuss with you is that Corn Ferry classification and compensation study. It was conducted countywide. Corn Ferry is an HR consultant that the county works with. So I believe it's about 1,700 staff positions that Corn Ferry reviewed to see if the salaries were at the appropriate levels for those staff. Their results were presented to the Board of County Commissioners on Valentine's Day, February 14th, last Tuesday. And they presented that the county is going to work in a structure that will decrease the number of different gradations and classifications that the county uses for their pay structure, and it will widen the pay range from the minimum to the maximum of the range. So employees would have longer opportunities for increases in pay under the merit system before they hit the ceiling for their classification. And they reported that the countywide impact is going to be about $11.5 million from those changes. We don't yet have the information of what that means for our specific positions. So we weren't really able to address it in the budget at this time. We're told that for the health district, it's anticipated that that's going to be somewhere just under $1 million. But we also don't know how much of that we may already have included within the budget, which is on the next slide. We don't know how much is included currently in our budget because I explained to you a number of those position reclassifications. And so some of those reclassifications we were putting in so that if Corn Ferry didn't address those, at least we could make the case to the county of why we thought those should be adjusted. But if Corn Ferry puts those in, then those reclasses won't go to the job evaluation committee and that process. So it could be we've got 150,000 of that or so already included within the budget. But the bottom line is we're going to need to adjust the budget as we move forward over the next month. And so what we're looking for your approval today is the budget that we've presented. And we don't really know what the county plans are yet as far as whether the county is going to provide some support for those increases that are occurring or not. I had a discussion with Manager Brown this morning, and he understands that we're going to need to be working together with him and budget and HR over the next month as we move forward. And he's also aware that this is what I'm presenting to you today as far as that approach. So that's where we're at today. We still need to work through what are the impacts from the Corn Ferry and how does that tweak our budget moving forward. And then, so the next steps is that under the interlocal agreement, I have a meeting scheduled with the county manager and the city managers on March 1st to present our budget to them. And then I will provide you with an update from that discussion of any comments, concerns, et cetera, from city or county managers that occurred during that meeting. But also on March 23rd, I'm expecting that I'll be able to brief you on the adjustments that we've needed to make to the budget to address the Corn Ferry results and incorporate those. And then on the April 18th BCC meeting, the county manager will present his recommendations. So our budget will be included within the recommendations from the county manager. And then on May 16th, the Board of County Commissioners will have their public hearing for possible adoption of the budget, and then it is required to be delivered to the Department of Taxation June 1st. So I know that was a
Can you
lot.
repeat that again? Any questions, thoughts, concerns? I know there's a lot that goes into this, so thank you, staff, for your time and all that you put into this. You know, the only thing that I'd like to say, and I want to put this officially on the record of saying, I have a goal. I'm honored to be the chair, and part of that is in these next couple of years is to make sure that we do our best to look into all that we do and make sure we don't find ourselves flat-footed again if there's an emergency in our community. And with that, we know that takes money, period. You can't do it without finances. And so I appreciate this. I think I appreciate your chess game of looking ahead, making sure we're good. But I also can say the little bit that's there, it does dwindle quickly. And so I hope that we can definitely find the finances and the means to make sure we look into what we do, make sure we're as efficient as we can be, and make sure we're there for our whole community, but especially for our most vulnerable. And so that's what we get to do. That's part of what we protect. That's part of our defense, or our offense, whatever you want to call it. We really want to be there. But I would say this is good. I don't see a problem for me with this. But I question, does it give us the ability to reach out and do more and make sure we're ready and be a community that's ready? So that's the only question I have.
Yeah, this has been a concern even when I was chair, that we have enough money in reserve. We found out the hard way, we didn't have quite enough when it came down. And it's a very difficult balancing situation for the county and everybody to sit here, okay, we have a pile of money and all it's doing is sitting there, where we've got needs and everything else. But the way it's kind of budgeted on a yearly cycle and everything else, we have to have some money just exactly for what you're saying. And I think that's something that we need to watch carefully. I think the fact is our city and county managers are well aware of this, but I think this is something that in the future, in the 26, 27 budgets, we need to have a certain amount of money just earmarked, even if it's sitting in the bank, making some interest for the county and all of us, but something that we can draw on. You know, you look at this COVID, it hit us real quick, real hard. So we just got to learn from what we got hit in the head with.
Any other questions, thoughts? Okay, very good. I know we definitely need approval on this. Do I have a motion from anybody?
I'll make a motion to approve as presented. Great job, Kevin.
I have a first. Do I have a second?
Second.
I have a second. Any other discussion? All in favor?
Aye.
Aye. Any opposed? Passes unanimously. Very good.
All right.
Nice,
Thank
nice
you very
work from
much.
Jack and his staff, too.
Yeah, we've got a
Yeah,
great team.
thank
you, sir.
Great team in our divisions. So, and next, we've got our staff report and program updates. So let's begin with Mr. Vega for air quality management.
Thank you, Mr. Health Officer, Chairman, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I just wanted to highlight really quickly, I did put some information on some Inflation Reduction Act funding that is available for environmental justice grants. I will say we are trying to follow a lot of the funding that's coming out of the Inflation Reduction Act. It's a lot of money. This one specifically was for government-to-government programs and for local governments to work with community-based organizations. But again, this is just one pot of money that's available out there. Again, we're trying to keep track of it. It's a lot. It's kind of a moving target at this point, to be honest with you. And we're trying to see how we might be able to utilize some of these funds to support our region. So with that said, if you guys have any ideas that we might be able to use some of these funds, please reach out and be more than happy to have that discussion. So again, we're trying to track as much as we can the funding that's being made available, and then we'll look for opportunities to use that in our region.
Thank you.
With that, I'd be more than happy to answer any questions.
Any questions? Thank you, sir.
Next, we have Ms. Lotritz for Community and Clinical Health Services.
Hi, Lisa Lotritz, Division Director for Community and Clinical Health Services. I have just a couple of things to add to my report. For immunizations, as Kevin mentioned, COVID vaccines are decreasing, the number we're seeing. So we are doing some restructuring in our clinic. Finally, we have some staff, core staff in there, so now's the time. So as of March 1st, we're not going to have a COVID specific window anymore for clerical. Clients will go to any window and they'll be checked in for COVID. And then as of April 1st, we will no longer have a dedicated COVID nurse. Staff will it'll just be another shot we give in the clinic. And that one is a little bit harder to integrate. With the pandemic, we brought in a lot of nurses, and many of them were only trained for COVID vaccination. And so we're taking the month of March to train those nurses that had made that decision, if they choose, get them up to speed with all of the other vaccinations. And then for us, this is a balancing act because we, as you saw, we have a lot of per diem staff and we want to maintain them, but also with operations not having the work, it's we can't have as many people on the schedule. So it's a balancing act and we're working with that. Speaking of one, our Miss Katie Doyle, our homebound queen, today was her last day. She sent me a text that it was the end of her watch. She was at the jail, and they did over 150 vaccines. So, yes. Oh, no, that was yesterday. Yesterday they did 150 vaccines, and 85 of them were COVID. So that's good. And she is moving on. She's moving to Seattle to be with her family. So we will miss her. But we have a new homebound nurse, Connie, who is here today, is going to be working with Robert on that. So we're excited. For family planning, as Kevin mentioned, our Title X grant is ending March 31st. And that is pretty heavy lift for us as far as the grant closeout. Mainly it's with 340B. We have to, anything that is in that account, we have to transition back to another entity that does Title X services. So that's going to be a heavy lift and just making sure everything's squared away with the new ARPA funding for that. And I think that's all, but I'm happy to answer any questions.
I just encourage you. I know change is hard and you guys ramped up, but then you got to change again. And that's interesting. And so please give a big hug to your staff. And I could imagine that we say nice words, but I'm sure it's frustrating as well.
It's hard for them. Change is very hard, but they're troopers and they're taking it well.
Well, if there's anything you think we should know about, please, through Kevin, let us know, or through the rep, one of us will be working with you closer. We're very interested in how we can help.
Great, thank you.
All right. Next, we have Environmental Health Services and Ms. Dixon.
Good afternoon. For the record, Erin Dixon with Environmental Health Services. Just a few items I would like to highlight and point out for you. We did highlight our SB4 inspection program at the beginning of our report here. It was brought, SB4 was legislation that was passed during COVID. It was brought up during the governor's speech, and so we just wanted to highlight a little bit about what we did. Just as a reminder, it was statewide regs that impacted resorts in Clark and Washoe counties, but resorts of similar sizes, such as South Lake Tahoe, were not impacted by these regulations. So our team did implement the regs, often without consistent state direction, and it also expanded our roles outside of our traditional EHS responsibilities, which was an interesting challenge for our team, but they took on very well. To provide the required resources to implement these regulations, EHS relinquished 2 grants. Now, we have since gotten those back, and so we're very excited about that as well. There were a few positives with this legislation, such as improved relationships among public health across the state. And we had many, many lessons learned. If we are ever in the situation where we have to write similar legislation, we will have significant input and suggestions on that one. But kudos to the team for doing that. We ended in August. Our last fine was paid in November. So we will not be moving forward with that program. It's very exciting. In addition, last month I brought up that we have a number of smaller water systems that have been testing positive for different things at a higher rate that we've seen in many, many years. And under the safe drinking water section, that we highlighted 2 of those systems and kind of the experiences that they are having and how our staff is responding. And so I just wanted to highlight that if you were looking for more details on some of those water systems. And those are just 2 that we are working with. And then finally, last year, this board approved the UST permits and fees. And out of the 218 that we have in our county, we only have about 10, I think under 10, that haven't fully paid and gotten registered. So now we're going to start hunting those 10 down. But kudos to that community for really stepping up and taking initiative on that. And that's all I have, unless you have any questions.
I do have one question. Just with it being so wet with our vector-borne, are we expecting to be expanding that program just a little bit more to hit the need? Do you think we do we have enough out there going on? I mean, it's going to be snowing for the next 3 months, so.
It's going to be snow for the next 3 months, unfortunately. I'm struggling with the amount of snow we're getting. I actually just asked our senior environmental health specialist for that program yesterday. He thinks we're in a good spot right now. He thinks we're going to be okay.
Thank you. I appreciate that. Any other questions? Thank you so much.
Thank you.
All right. And next we have epidemiology and public health preparedness. Dr. Dow.
Good afternoon, Mr. Chairman. Welcome back.
Thank you.
And members of the board, this is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I don't have anything to change or add, but I would like to highlight, as mentioned in the report, that our public health preparedness program has continued effort to support our schools proactively in schools' emergency operations plan updates. The board of trustees of each school district and the governing body of each charter school and private school are required to establish an emergency operations plan committee to help develop and update a plan to be used in responding to crisis, emergencies, or suicide. And the legislative requirement is to have now at least one member of such a committee be a representative of the county or district board of health. So our program staff has been proactively reaching out to our schools to let them know that we are an available resource to them since the July of this year for this fiscal year, July of last year, sorry, for this fiscal year to support that process for them. And so far, we've already attended 6 meetings total with 2 charter and 4 private schools, and we have quite a few upcoming meetings being scheduled. Also, in our epidemiology program, we have seen a large drop in the number of reported outbreaks in January and thus far in February compared to what we've seen in December. The height of outbreak numbers were in November of last year and December of last year. There was already a downward trend from November to December, and the drive for those outbreaks were dominated by respiratory illness as expected. And that's all my update. I'm happy to answer any questions you may have.
Any questions, concerns? Thank you so much.
Thank you.
Keep up the good work.
All right, and I'm up next for the
Yes, sir.
District Health Officer's report. Just wanted to highlight a little bit on communications. I mentioned we have the contract now with the Abbey Group, and they're working hard on the rebranding and starting to share some ideas with us. So hopefully be able to report some progress back to the board soon on that effort. And you probably saw in the news, I tried to keep you informed about the Yim's Asian Food Market and Happy Tears Bakery that recently we had issues with that were conducting food operations that they weren't permitted for. And so we got, I think, really good media outreach on them. We're working with both of those facilities so to try to help them realize what they would like to do with their businesses, but perhaps got things in the wrong order as they approach that. And then hopefully you'll see some media coverage this evening. We partnered with Truckee Meadows tomorrow for a speaker series event at Reno Public Market, which was at noon today, and to present on the community health assessment. We have a panel with some other partners on there as well. So looking forward to seeing how that went. And I'd also like to mention that during February, we've had several of our health equity classes for diversity, equity, inclusion, and cultural competency for staff. Have had good attendance at that, and have heard really positive feedback from staff on those sessions. So that effort is continuing. And on the regionalization discussions around fire, EMS, and dispatch, we had the Federal Engineering Facilitation team in town the end of January and into the first week of February. And I was able to participate in their site visit with REMSA that Truckee Meadows Fire Protection District also attended and participated in. And then we had regional workshop meetings on the 6th, 7th, and 9th of February, and some discussions with them and some ideas on moving forward with how we can improve that system overall.
I do want to just kind of dive in for a moment on that, just because some of the regional conversation dips right into our franchise agreement that we help oversee with REMSA, and want to encourage, thank, and then get a little update of making sure our role, and make sure you guys understand our role as well. I mean, it's a different one. I mean, so each of us wear different hats a little bit. I mean, the commissioner has two hats she's going to play in this. I have two hats as well as Reese. But us as a board, the one hat we wear is once some of these decisions are made, we get to help hold everybody to what was agreed upon. However, I would also say, though, we should be in those discussions. We have to be in those discussions because of what's agreed right now. And so with that said, it's a role that we get to give more advisory type things as decisions are made. However, our voice is not mute. And so I do want to make sure we get continued updates, want to make sure you guys know that if there's a question you have, it is important that you ask it. It doesn't mean that everyone in this whole region's going to say, oh, Ms. Danko thinks this. It doesn't work that way all the time, but maybe it does, because you actually are the receiving end of some of that. So you might, so please just know your voice is very important. It's important to me. I'll help make sure that we're heard, but really our role is not necessarily to make all the changes, but it's to help once they're decided, to help bring them about and work with REMS and stuff. So I think I hit that on the head, I hope. But would you give us a little update on how that's going?
Yes. So this morning I had the opportunity to remind the group of the importance of the engagement of the health district and Board of Health in the process, because the REMSA franchise agreement does include there in it, it designates REMSA as the dispatch center that provides for emergency medical dispatch for the community. And so part of the discussions that are occurring is how can our PSAPs work together better and more efficiently and communicate in a good manner. But there's also some consideration that's being placed on whether we should be changing that structure and allowing some of the EMD work to occur in other dispatch centers as well. And so it's going to be very relevant to the board as those discussions continue, what's being proposed there and how is that going to work. And so hopefully we will be engaged in those discussions. I was disappointed in that on the meeting of the 9th, I had requested that our staff, specifically Sabrina Braswell, who was here earlier today, be included in the PSAP work group that's being formed. I think on the positive side, REMSA is now included in that work group with the other PSAPs, but I was told that there was agreement that we could participate, and we weren't invited to that meeting. So.
Well, and I say this, we're still in conversations. I'd ask, and this is where our selected comes in, and is that let's help make sure we can bring that back to our base and say, hello, what are we doing? Because we have a role in this, and there might be a decision in the very end that we don't have a role in this. I mean, that's actually a very real conversation, but until that actually is decided, we have a responsibility. And so that's the only thing I would say to that. But I do think that our place is important there, and I do think we bring something good to the table when it comes to just a regional outlook that's not in the mush, not in the pieces of it all. So thank you, I appreciate that.
And that concludes my report.
Any other questions or concerns?
All right, well, that brings us to board comment.
Hey, anybody have any board comments or anything? Please go ahead.
Thank you, Mr. Chair. I just wanted to take a moment to thank Mr. Kevin Dick for the wonderful onboarding I received back on January 13th, and also extend my gratitude to Barry Duplantis over there, who gave me the REMSA tour and update just yesterday. So it was really nice to be front-loaded with this information to help prepare me. I didn't think it'd be a good look to show up to my first District Board of Health meeting sick, so I apologize for missing my first one. But I'm here now, and I'm really excited to get to work with you. Thank you to the members of the board for all your years of service. I was grateful to meet you today, and Mr. Chair, welcome back.
Thank you.
And thank you for welcoming me today.
I appreciate it. Mm-hmm. Anybody else?
So SB 118, our district health officer gave us a great overview of what's going on with that. But one thing he neglected to say is he was able to present on this along with other health district professionals throughout the state of Nevada. And I sat in on the hearing, and I got to say, Kevin Dick did an excellent job representing not only Washoe County, our health district, but I'd have to say all northern Nevada on what's taking place. And it was very well prepared, you could tell, and it was really nice to see, and then see Washoe County, get what it did. And so great presentation, Kevin, and it was really nice to witness it, so thank you.
That's good. And I do want to do one reminder to you just as we go, just my comment. Anything in legislation that ever seems that we should be there, please let us know. Okay. With that said, we are adjourned. They're representing. Oh, thank you. Well, then, good job. Attaboy, that's right. We talked about that.
Recording stopped.